Meantime, tonight, doctors in Birmingham performing their very first COVID-19 blood tests. They check to see if patients have had the virus and if they've developed antibodies against it. Our Malik Rankin joins us tonight with an inside look at how it all works.
When patients are tested with a nasal swab for COVID-19, it can take anywhere from 24 to 48 hours to get your results back. Now that some doctors are offering blood testing, those results come in about 10 minutes. Tim Norris tested positive for COVID-19 3 weeks ago. He says his initial symptoms were fever and fatigue.
I felt bad, very bad, just like normal flu symptoms.
His fever continued to climb, prompting him to call the doctor.
I just thought I had a cold and maybe just, mild temperature until I got up to 102. Then I decided I better come see Dr. Bentley.
Norris is now symptom-free and not believed to be contagious. Dr. Amy Bentley Ijeskes brought him back in to administer a blood test.
The great thing about this blood test is that it's minimally painful, just a little finger prick, just a couple of drops of blood, and within 10 minutes, we're getting a result.
Norris's test is on the left. Dr. Amy tested herself. Hers is on the right. The IgM shows if a patient was recently infected with COVID-19. The IgG indicates if an immunity to the virus has developed.
And so with his being faint, I think it's reasonably safe to assume that he's no longer contagious and he's probably immune. But you have to understand that there's a gray area, and darker lines like you see on his IgM are definitely indicative of higher antibody counts. The absence of lines like you see on mine would tell you there's no protection that's been conferred.
While doctors still work to understand more about COVID-19 and recovered patient immunity, Dr. Amy says there's no guarantee you won't get the virus twice.
If the strain mutates, just like the flu can mutate, just like a vaccine would no longer be protective, a prior infection might not be protective either.
Norris has been cleared to return to work. He says he's glad to be feeling like himself again.
I think the good Lord has watched over me.
Over the weekend, the FDA announced these blood kits will now only be sold to hospitals. Dr. Amy can still administer her remaining kits as needed, but for now, she won't be able to purchase more. In Birmingham, I'm Malik Rankin, CBS 42 News, local coverage you can count on.